I dey salute all man wey go watch this health talk. So a topic wey we go talk today na alcoholic liver disease. So na disease wey e dey happen because of the alcohol wey you dey drink. Whether you dey drink too much, dey cause a disease for your liver. So I go start this topic for first explain for you wetin be your liver. Before then I go to tell you the sick way it go happen when you drink too much alcohol. So as usual, they always try to introduce a little bit of that system. Then I go tell you the disease way they affect that system, so if you understand them a little bit better. So too much alcohol get problem, or the cause problem for your liver. What to be your liver? Well, liver na that machine where it is for we are right side for your skin. So for the right side for your belly. So as Monday, so it get a heart way there for this left side. It get the part where chop they go there for middle. It go down so they go reach your belly. It get the lungs them where they for the side them, both side, right and left. So just below your lungs now your liver. You feel touch your when you pass your hand around your right side, so just close to your bone them for ribs and your stomach. Now for there your liver there. So your liver it just sit just on top of your stomach. Your stomach na that part we chop the go rest for day before it go down into your intestine. So your liver they should just on top of your stomach, and then below your stomach till you get your kidneys, and where they right and left kidney, they're just there for your hip bone area, close to your hip bone. Now for there your kidney there. So you get your liver for up here for your right side, then it sit on top of your stomach. Then just below your stomach, as you go down, you go meet up your kidneys. And those two things that way they look like beans, they're there for your right and left side. So your liver be, I think all man don't see liver for cow. With the chop liver for cow or liver for pig. So most people don't see liver. It be dark reddish brown. It get that dark red color. So when you see that kind one, so na fine liver, that means it be healthy, dark and reddish. For most adults, them it weigh about 3 pounds. So I get picture for you where we go show you how your liver day on top of your stomach, and then your intestine they just day below. So your liver na engine for your body where it do plenty work. Research where some people they don't do, and they show say the liver get almost 500 function the way they perform them. So plenty function where the liver it perform about 500 function. So if you have 500 function, 500 things the way they do and for we. So it means say if you lose that liver, you don't really lose a lot of things. You don't really lose a lot of things. So the way the liver the work now say you get that your red blood way na they carry fine thing them for inside your skin. So you cut your finger, or sometimes you cut some area where na red blood they come on. Now that red blood get that fine thing that way your body need them. Then sometimes you get the black blood. Black blood na that one way, or dark red. Now that one way the body don't chop all the fine thing them. Then na that other na the blood that way all thing don't come off for them. So red blood it carry everything, it take and go for we are liver. So everything where we chop, food, plenty fufu, everything we chop, after it don't go through digestion, as I be explain and for that other previous video, it must go through your liver. Now your liver go then select that good things and where your body need them, then throw the one way your body no need them. So your liver get plenty function for do. So if you take there your chop, it fix them, give you plenty thing there out of that chop when you chop them. So almost everything, when you drink medicine go through your mouth, go through your stomach, it must go for your liver. So your liver go select the amount of that medicine where you need them, it give them for you. The rest of the medicine, it throw them for outside. So your liver, they do plenty thing them for you. Plenty. So I will start explaining the thing them again. So when you chop, it digests, it go for your liver go take them, it turn them for good thing them where you go use them. And like I be explained, 500 function, that one are too much function with the liver they perform them. So example for the thing them, when you chop thing like fowl, or you chop thing like a cow, goat, they call that one, they say protein. So now that good protein way you need for chop protein with your meals. So when you chop that protein, it go through your belly, go through it go for your liver. Like I be explain, everything will go for your liver. Your liver go take that protein now, it make for some fine thing way. Now it help for build like your skin them, they call them protein building blocks. So it help for build good thing them for your skin. It help for build good thing the way your body feel use them for build other things. So it dey like now that person will produce that thing the way you go your body feel use them for make a building block. So if you know the chop, you know chop and you chop protein, then your liver no fit fix that protein them into good things and where the fit build a building block for your body, then that one a problem too. That fat way you chop your liver go take after it don't go through your digestion, it come, your liver go take again, it fix fine thing them for day where you feel use that. Now that fine thing them way it help you forget like energy where you feel do work where you do around and so on. So nothing that way the liver they do for you. It also help for produce until when sometimes it be you hear man say it feel like say vomit bile, or you feel like say feel bile for your mouth, bile the bitter. So you feel like say you feel bile for your mouth. One of the thing where the liver they do now say they make that bile where it go then make that bile, then it send them for gall the liver go make something where it go help for make that bile where they for gallbladder. So gallbladder go then or some other thing. So that bile where you the feel and sometimes your man a good thing because now it help for dissolve fat for your skin. So when you bile, it squeeze some small bile, it mix with that fat, then it go make the fat be able for work through our skin, because you know say fats are be float on top water. When you put fat or oil on top water, it not the mix with water. So how you think say they for your body? Say you go chop fat, then you go mix with the water with plenty for your body. Now that bile way they for your body, it go turn that fat, it make and so if you mix inside water. And that bile now one of the things that we liver it help for making. Liver it help for use the iron for your skin, help you forget blood for your skin. So when your liver not the work to another problem that because that iron them where they come, your liver not the fit change them for help you for fix more blood where you need them for your skin. I be talk say that protein where you chop them, then your liver get to fix them for make them for find. If your liver not fix that protein when you do work for inside your body not be fine thing. I will explain that part again when I reach the problem where liver the cause them. So if you not change that protein, na problem for body. Now liver they help you for glucose, so carbohydrate. So I don't talk we chop protein when a cow goat. You chop fat where you chop like a pig or oil for chop. Then the next thing are your carbohydrate are plenty for food them where would chop gari where would chop. So liver go take again when you don't go through digestion, liver go take that excess too much fat we don't chop or not enough fat we don't enough cassava or rice or those kind of things, don't chop them. It don't produce that energy we will need them for your body. Liver, they take them, it store them. It store them because time they be way we no chop. So you feel be maybe 2 days, 1 day, 2 days where you not even chop, you not go die now because your liver gets some storage for the way you don't keep that energy for the that carbohydrate the way you don't chop and everything. You don't keep them for this. So you go to spit out small. It give you small power where you go use them as you never chop. So now one of the things that the liver they do. Then medicine the way you drink them. When you drink them, it go for your belly, go reach for your liver, come back for your liver. Your liver get to take the good one, them it help you get better. Bad one, them it send them for out. So if your liver not the work, who will do that work? Now your liver liver to the produce until way. You know when you cut your hand, so blood it start bleed. Then you squeeze them, you prevent you the whole and say make it stop. May blood not the pour for outside. Now your liver they produce that thing where it go stop you for not continue for bleed out, for not continue for the bleed. So if your liver not the work, then when you cut your hand, that blood go only the flow because that thing where is supposed to stop that blood for no the flow. Now your liver it produce them. So now your liver go produce that thing before you stop for bleed. See, important function. Now your liver they produce some that protein where you chop and toxic go make for good things that it produce until the way now it help you for fight disease. People the way their liver not the work. When that thing not day too now another problem that because you don't lack that thing where it help you for fight disease. So small disease one pass, picking one cough only for corner so or so you don't carry the disease. I'll give you a story about that. I be know of this mommy where a liver not be the work. So if you don't know say liver not the work. This thing where can finally kill that mommy. Nobody liver way not the work. Now small people will get chicken pox for that house. Mommy get chicken pox because of that small picking we get chicken pox for house. Now because you not get way for fight infection. You not get any resistance for fight infection. So it pick up that chicken pox from that small picking and I think that will kill mommy. Not even that liver. Now that chicken pox it finally kill mommy. Usually chicken pox not the kill most people them. But because mommy not be get power, no nothing for his skin for fight that chicken pox take it go. So the important thing that your liver they do. And then your blood they so when you see them when you see like cow on blood we don't leak for down, you go see some yellow thing that way they come out past part of that blood, they call them plasma. When the blood don't sit for ground, some it don't start the red part go come out, some white water part go come out, yellow and so on. So sometimes it contain weight they call them when blood don't break down, it release until they call and say bilirubin or it release that yellow thing. When that yellow thing it come out because blood not the blood to the it get a length of time where it stay for your body. So when that blood don't break down, that yellow thing that will come off for your skin. It will come off that blood. So it go to work for your skin. If your liver the work, your liver go take that yellow thing, it form that bile, then it send them where the bile go be useful. But if your liver not the work, that yellow thing that go accumulate, and then it go be only for your skin. It work they stain all your skin, then it give you that yellow eye them. So alcohol and liver disease. Drinking too much, especially sometimes some people they drink bottles upon bottles of beer. Too much, it task your liver. It will put too much work for your liver because like I don't explain for you, alcohol it go for your belly, it must go for your liver. Everything it go for belly, it go reach for liver. When as it go reach for liver, na liver be clean house as they call them, as I call them. Now clean house. When you reach for the too much, liver say, oh my God, this one are too much alcohol. It overwhelm the liver. So now from that overwhelm way, I will discuss how your problem go start. So drinking too much every day, Not every day. Once you drink like 10 bottles, 6 bottles, 5 bottles, you do drink too much. 3 bottles, you drink too much. You do overtask your liver, because it get other plenty important work where you need it for do. Then you dey add alcohol for the way it make it work. It is too much. So too much of that alcohol, as you put out the liver, it cause problem for that liver. It injure the liver. Okay, so for most people them, for American own guideline, so I'll give you American their own guideline. They say 1 drink a day for women be adequate. And when they say 1 drink a day, no be we are kind drink. We are drink them a big bottle. They're big. I will show you an example for American drink. Now, their size for their drink this. Now their size for their drink this. I know the one show the name because I guess you know they usually get to show name when you show drinks. You see how small the size they. No be that way a fat bottle. I think we a fat bottle may take maybe 2 or 3 of this bottle, maybe 2. I never measure them. But see how their size for their mean body. So now 1 this enough for woman. 2 enough for man for 1 day, not more than that. Okay. So 1 drink, they say 12-ounce bottle of beer. When I in that way, I think I show you. Yes, 12 ounce. And then 4-ounce glass of wine. 1 ounce shot of hard liquor. Hard liquor, that brandy. Only 1 shot for 1 day. 1 day. I need to talk for 1 time. 1 day. 4 ounce of wine. Not like small glass of wine. Be enough for 1 whole day. Okay. Okay. So damage with alcohol they cause for liver. They cause different stages of liver disease. So it depends on what stage where you finally recognize, say, oh, I despoil my liver. You fit prevent further damage. But once you don't reach that final stage where you don't damage your liver, too bad. Nothing not there again. You will either end up for develop liver cancer or you develop liver failure and we go kill you. They say alcohol remains the 2nd most common cause for liver disease for Cameroon. Hepatitis B na number 1. Hepatitis B, we will talk about hepatitis B after this topic. I feel like I need to talk about alcohol first. Hepatitis B na number 1, and then number 2 na alcohol. Alcohol na the most common reason for liver disease and cancer, liver failure for Cameroon. Okay. According to World Health Organization, they rank country them for Africa, the one way they drink alcohol most. Actually, this surprised me. Cameroon are number 2. I be they expect they will be number 1. Cameroon are number 2. First country na Gabon, small Gabon. They drink to like fish. So Cameroon are number 2 for the whole Africa for the amount of alcohol they drink. Most people them, an average of a Cameroonian, they drink 9 liters of alcohol. Oh, on average in Cameroon, 9 liters of alcohol beverage they be drank by 1 person a day. That is a lot. You see picture of man don't drink saute vomit self. He still the drink. He hold a 3 export for a hand. See how we are on alcohol them big. Cameroon bathes in alcohol. So now we are daily thing that off license. First thing for morning or Monday for day. They just go wash. Instead of go wash your bathroom, they go wash now alcohol. Then after they drink the alcohol, they go piss for backside. For backside day. See the amount of beer the way they drink. You go get some 3 men then so they sit down. They drink saute a whole table flop with the alcohol for day. They don't know say that they damage na their liver. They don't know say that they shorten their life. So they did really shorten their life as they drink that alcohol. And then alcohol too not even cheap. We talk say we not even get money, and yet we spend all we have money. The worst thing will ever happen for that country in Brazzaville to Cameroon. Actually, they destroy that country. People do not feel live their life only for wake up for morning time, run for off license, drink. What's all the money they come out? And then when they're sick, they say they don't get money for buy medicine. What's all the money they come out they spend and so? French company don't can't open place for they carry all our money then go for France. When I go see road them for France, when I go see hospital them for France, when I go see building them for France, they can carry money only from we. We go drink, give Frenchman the money, Frenchman take and go fix your own country. Would they suffer? I don't talk say alcohol, they show chances of having liver cancer. 10% chance say you go get liver cancer for around our region if you continue for drink alcohol. So other than the fact that alcohol say go give you liver disease, what will be the other problem that alcohol fit cause? Alcohol they affect your brain because alcohol they easily pass through they call it the blood-brain barrier. That's your brain, it gets some protection where bad things then do not enter there very easily. But alcohol be able to pass through this barrier very easily. And when alcohol don't pass through this barrier, it make the person, now the reason that you get how many accidents from people the way they be intoxicated. Sometimes we not even pay attention. Driver they for park where they pick people them for drive them from one town to another. The bus driver go can put a bus. He go for off license, go sit down, they drink. And then they put passenger the inside. The passenger they see where they come for that off license. Sometimes they even worker say food not steady for ground. They not just say, I'm not going to enter that motor. That driver don't drunk. No, the all man enter inside. We really see say that driver drunk. Sometimes I wonder what do they think. And then we enter inside the motor. He jam other motor. People then die. Would you show surprise? Apart from bad road way na number one reason first for the accident. Second other reason, now this idea so we not even think about prevention. We not even think about safety. We not even think about the importance of life. No wonder we did die in the 40s and 50s. We don't put life as an important thing. We just work every day, just pray, say God could just help we live long, help we live till the age of 90. Okada driver drunk. He go drink for off license, drink. Can't enter on, can't sit down on top of bike. Mommy come, he smell all the alcohol, he hear how he talk. say you don't drunk, it still climbing on top the bike, and then he go he kill it, and you will show surprise. No surprise in that. I remember a few years ago where I become home for Bamenda. I meet up one of our classmates who be the nursing school. I meet up where we go with my brother-in-law for go see some other family member. He said, "Mo just take some Mimbo drink." So I go there, meet other my classmate. Of course, drink. Everybody to drink like fish again. Drink. After we don't finish, me and my brother-in-law we get to leave. Then my classmate get moto. He talk for me. He say, "Oh, I feel drop on her for house." I say the stagger. I look here, I say, "Are you kidding me? I don't think so." He said, "Oh, I've been driving like this. Oh, I did drive like this. I did see better actually when I don't drink so." I say, "I don't think so." I look here, I say, "You did go enter that motor?" He say, "You think so I go house now how?" I say, for who side with me I come out, which is for US here, they go put it for jail. If police stop it for road, enough it take steps them straight, because they make you work out for see whether you don't drunk or not. And depending on the amount of alcohol we did for your system, and from that, from me, I be say the amount of alcohol they for lucky for jail, so they seize the license. Seize the license, he not go drive for a while, and he go get to go through alcohol, non-alcohol driving training. For sure, say he no go drink any alcohol before he drive again. Pass the exam before they give you back a license. I tell you, see, you know, if you carry me. Also, if not for here too, I will say, "Give me your key." You know, if you drive. I ask him, say, "Give me key, more call it taxi." He tell me, say, "No." He say, "Come on down that thing for white man country." I guess he drive, he reach house, because I still see the next day. Lucky break. But yeah, alcohol, it cloud your judgment. Most of the mistake that we would make them all the time now alcohol. During that time we do for off license, you detox me, they give me before all man. Now because your brain don't be clouded. So you waste your money, you give them. Now afterward you realize you spend a lot of money for inside that off license. I don't know whether you be intent for spend them or not. You see. Okay. Another thing where alcohol they do now, people that they drink alcohol, if you look them from the beginning, in the first instant, the people that they first gain weight. Alcohol, they actually make you gain weight. So you start first now for gain so much weight. Then now after it don't start affect your liver, then that time you start lose weight. Most people that go don't lose weight, and then you get this nausea, you get this vomiting, and so on. So you be malnourished. You don't chop, go for stomach, too much alcohol, stomach no fit take all this alcohol for inside your stomach will chop. So it'll make you feel like say you the one vomit all the time. So most of these people they not get good things and for their skin. We call them vitamins. They not get a good vitamin for their skin because their body no fit absorb that good vitamins again for their skin, because alcohol they disturb their stomach for absorbing them. So that they lose weight, they be malnourished, they, like I talk, they not fit fight infection again, because the liver now they produce the good thing, and then any disease we man one cup for corner, you don't get them. And also you be at high risk other than liver cancer. Some people they develop cancer for throat, and then you develop cancer for stomach. Again, as I explained, alcohol don't go for the chop today for the it overwhelm your stomach. You develop cancer for stomach with long time. You develop cancer for colon, but the most common one now liver cancer. So they say, so you drink the alcohol 90 to 100% of the time. Most people, they drink alcohol, go develop alcohol disease. And I go tell you, alcohol disease, I call it alcohol disease because they 3 stages where you will go through. So you get the first stage where I tell you, say, when you start drinking that alcohol, you the first fat. So the first stage, now say, as you the fat too for outside, so you the fat too, your liver too, they put fat for your skin. So the liver, they develop too much fat. That kind of person, if he die, you go remove that liver. Instead of that shining dark brown color you see, you go see fat all over the liver. And when fat plenty so all over the liver not fit do the work where it be supposed to do. Because now liver, they call it liver cells. Now the real liver itself get to do the work, not be fat. So after 90 to 100% of people where they drink, they go develop fatty liver, fat liver. Then 10 to 30%, again, the same, they call them still fatty liver. Then 8 to 20%, they will develop what they call them, say. So the first one, I say 10 to 35%, they will develop liver hepatitis. Hepatitis, they still say liver disease. So you get fatty liver, you get alcoholic hepatitis, then you get the one way you don't reach a final stage where you 8 to 20% you call them, say they get liver cirrhosis, alcoholic cirrhosis. So these people, they don't start reach a final stage where there is no turning back, the liver don't spoil. Now there is nothing you can do about it. So I will explain again more about this different stage which they happen for the liver. Then you get the one where the feet develop cancer. So you hear someone die for Cameroon, and the one ask and say, what happened? They say you get liver cancer. They only talk say you get liver cancer, but most people they don't know how you develop liver cancer. So 1, either from the alcohol, 2 from hepatitis B. But most cases for liver alcohol. So alcoholic liver disease, they say women are more likely to suffer liver damage than men. So woman, they wanna get to know, as when I drink to the same way like man picking them, when our own disease be faster past man picking them. Okay, so I explain again, you get 3 stages where you go. You get that one with a fat for liver, too much fat they don't build inside the liver, and at the first stage that, and you too get fat too for skin with that big belly, we call that beer belly, and then we laugh, but it'll kill you. Then you get the one with an alcoholic hepatitis. Okay, so what did it happen? Now in this liver, as I explained, they do too much work. 500 work where they do that clearing house, too much work. When you also drink alcohol for the liver, a day, my explainer, a day, when you cut your foot, let's say you do waka and you kick something cut your foot, or it cut your hand, my use hand for year, it cut your hand and the wound big. You go for a house, you start put medicine for day, then the thing one heal, it leaves scar. Oh, like this one, so example, the one we been a vaccine, it leaves scar for your skin. That scar way it leave for your skin, this area for scar, it own blood where they come for day. They get blood very well for that scar place. So if you get another wound for the same scar, it will take a long time for get better, because that area don't already change. It is different from your real skin. Scar now what thing, because that area this, so you no one forget another wound for it, because blood not go they fine. So now say it did too for your liver. So every time when you drink that alcohol, it did like someone hit that liver when you hit that liver, so you don't injure or you don't make some cut for that liver. So the liver good thing na say God be not say liver get plenty work, or God be make liver say make get plenty work. So it make us a liver to fit grow, regenerate as we call am. So as he try for fight that place where you that alcohol where you don't make am for day, it to go form scar. When you don't that area don't better, it go form which they call as a scar tissue. So that scar, each time when you drink the alcohol, plenty scar that they form inside the liver. Remember now they not like the real liver tissue, now artificial liver tissue them. Each time when you drink, it form scar. Each time when you drink, it form scar. As that scar the big, the first one they say they call a liver hepatitis, but as that scar say continue, you end up with what they call and say alcohol cirrhosis, alcoholic cirrhosis. Cirrhosis means say now all your liver and so scar, you know, get used again, you know, the function again, you know, they do the things the way it be supposed to do. So instead for function at 100%, maybe the function at 10%, 5%. So you will see the complication the way they will start happen after you don't develop that plenty scar then for your liver. I hope all man understand. It is start first, you develop fat them on top the liver. Then after that, as you continue to drink alcohol, your liver go to try for grow, regenerate. It will try for fix itself. And anytime when you try for fix itself, it will form scar. As the scar that it increase, that it take over the normal liver. So as they increase, they don't be plenty, the whole liver now only scar. That one, you know, be dark brown again. It be some ugly looking, like stone. It almost look like if you take that man in liver, you look like it go they like man pick stone for us, a big stone. So it go they like don't turn some stone for inside. It's still inside your belly, but you because you know the see it don't turn like some stone, brown looking scar looking thing. So now that one not be liver again, so you know they do it work. So you go get complication from that. And then after that, for some people they go progress where you go get a cancer for that liver. For some people they now only that scars will go kill you too. So I hope you don't understand the difference. So my way a liver still the way now only that fat don't grow for the now early stage that if you stop for drink, when I say stop for drinking in moderation, which I talk, 1 small bottle a day, or that 4 ounces of wine, or 1 shot of a 4 a day, or brandy a day. If you stop and you go back to controlling what you drink, your liver go recover, because I just tell you say your liver they grow, it fix itself. So it go fix itself back, it go come back normal, but it don't mean you go back or start drink. Okay, so for that man way on day na fat, usually you not see any symptoms at all. Sometimes you could just feel like, oh, I just feel a little slight pain for that my right side. So just every now and then you feel some slight pain for the now as much as that way you go feel out. So if you don't start feel some slight pain for your right side, just be for women that just below your breast going down a little bit, or men them. If you don't, just below your ribs, if you don't start feel, or if you put your hands so be just below your ribs and you can feel your liver, not be good thing. You're not supposed to feel your liver. If you put your hand down so you feel them, because it means they don't start grow a big, it don't start spoil. Okay, so again, as I explained, it be reversible. Okay, when you don't reach the second stage where you call it alcoholic hepatitis, sometimes people they start getting, when you don't start getting nausea. When I say nausea, that feeling say you want vomit every time. You get that pain for your side here all the time. Sometimes you just press so it the pain. You press out your hand so it the pain. If you don't start feel that pain, I'm sorry. You press and so you feel and so means you don't get that you don't start reach the hepatitis part, nausea, you vomit, or you don't start feel some small yellow for your eye, means that you don't reach stage 2. Stage 2 still be reversible. Remember, I tell you, say liver dey grow, liver dey fix the skin. If you stop for drink completely, stop for drink. This time, no be man we go to drink only 1 bottle or 1 shot. You just stop completely. That one now, you fit bring yourself back to a normal liver. But when you don't reach that number 3 stage, we'll call and say alcohol cirrhosis. Now you don't be serious. Serious. So at this stage now, it'll be very difficult for replace your normal liver again, because it already get a lot of scar tissue them for a skin. So it is hard now at this stage for developer. It take you many years for you before you develop that. But when you don't develop that, it is not good. It is bad. So man, we don't develop that one way, a liver don't turn out like stone. It don't be ugly looking like that because of plenty scar. Man, don't develop that one. Other people, the way when you see them, I will start from head to toe. One, it confused. It's a bit confused. Sometimes people didn't notice them because he talky, and then he go talky make mistake. Then he laugh. People then think say, oh, he just joke, but he don't start confused. The reason he don't start confused now because, as I be explained for you, that alcohol it go for your brain, it cross, and your liver not be able to clean the alcohol again. Second other reason I say that protein what would you chop, as I be explained for you, your liver get to clear that protein out of that meat, chicken, fish, what would you chop. And so when you don't digest, it go for liver change and for fine clearing house, it change and for finding them, then think the way it end up with the watching them, it throw away. So your liver not join that, enough do that work again. So most of the things then they go for your brain. They call it say ammonia. Ammonia go for your brain. When ammonia go for your brain, you dey confused. Sometimes you feel even go into a coma. When I say go into a coma, means you sleep, then you not feel wake up again. And then would they say, oh, you go sleeping or wake on a witch man don't kill you. No, na a liver don't kill you. Not be witch man. So now another thing that if it happen, you get into a coma, and when you get into that coma, and then they take you go for you still breathe. They take you go for hospital until they give you medicine where it go wash that ammonia, that thing where they for your brain. They give you medicine, it wash that thing. The medicine usually they make you shit that ammonia. Then you go wake up. Then you go feed it up. But again, that liver still the way not they fine. For the kind of people that made another chop chicken, fish. I mean, they feed chop a little bit of fish. Made another chop chicken, not the chop meat, not the chop goat, anything a protein. Made another chop again because your liver not fit deal with them. So now you don't deprive yourself of that nice meat where you be supposed to chop. Now you not be able to chop meat again. So because your liver not fit handle this protein with the chop, you get to limit or not even chop protein. Then coming down, I be talk again. I go down slowly. I be tell you how you do drink. So it pass through your throat. They call that part the esophagus. So it go through your throat. As it go through your throat, because the liver not the function very well. Everything get to pass through your liver. So you chop, it go for belly, it get to pass through your liver, the clearing house, it clean them, then it send the blood back for your heart, because now your heart be the distributor. Your heart go get to distribute all that blood back for your skin and so on. So when the liver now, it want try things and come now for come go for your liver, enough it go because your liver don't turn a stone. So they don't go for your liver. So the thing that the back up, the blood the back up. When the blood the back up, all the vessels them or all that pipe them where they lead things and for go for your liver, they go study. They become fat. They grow fat. They grow fat. Remember, by nature, God not be make them so make them grow fat. So when they grow fat, it dey man don't blow bolo. what do you mean? You put small needle for the job boss. So they grow fat. So that one there for your neck. As things that one go for your liver don't turn in a stone. If you go again, things then go backward. These vessel them for your neck, then too they don't. These pipe them for your neck, they don't fat. Small chop one pass, it just touch that vessel so it bursts. Boo, you vomit blood. Boo, you vomit blood. Nothing that means the liver not they work again. Another reason why you vomit the blood, remember the liver not they produce the thing the way they make that blood make it stop for bleed. That substance they not there again. So you bleed anyhow. Even if you cut your hand, that blood just flow. So now the same thing that neck when it don't happen. So that neck vein them the thing burst, you just vomit plenty blood them. Now because your liver not they work fine. So you don't talk about head, you don't talk about your throat. It go down even for your belly too, because your belly now it push now it send the thing the way it come up for your belly for your liver. Them too, because everything they come backward, your liver your stomach it on pipe them too. They go down big into the bus. So you bleed. You feel bleed from your stomach, if you bleed from your neck. Another thing now, I be tell you say when blood stand, if you look at it go to separate, you get that red part and then you get some part with a yellow. Now liver they deal with that yellow part them. So since liver not the work, that yellow water it go just work out all through the skin. They call them bilirubin. So it just you see you look the man in the eye yellow. It don't turn yellow inside the whole eye the yellow. So you see man they talk for you, so your whole eye don't yellow. Now one of the things in that it look sometimes even like the nails them. Sometimes for black people them it be difficult for see them because already our eyes them be a little bit difficult. So until money eye don't really yellow, it is hard for see them. But for white people them you quickly see that yellow eye because their own eye be whiter than our own eye. And also for black people for white people them, so you quickly see them for white people them, and also for white people them you see them for that their skin. You remember they get that their pink skin, or they call them say white skin. So it go don't be for their skin. Now you look money they like gold, you fit turn into gold. All the skin it don't yellow like saying a gold. They it rub them for his skin. For black people again it hard for see, you see them only for their eye. I come back for stomach again. I leave some part for stomach. We that one to see I'm over for home. And then it talk be a belly. Some belly the way they call that belly say ascites. Man be like say be 9 months pregnant or 8 months pregnant, 6 months pregnant. We carry picking for inside so water they for a belly. Now another thing that it happen when you see man where a liver don't spoil, it be pregnant. Tiny little food them so because the chop fine again, it don't dry. Tiny little food them so tiny little hand them so everything they na for belly, big belly. They call them ascites. And this one again na because the liver not they produce the thing where it's supposed to produce some where it prevent you for the keep water inside your skin. So I be don't give a lecture about water for skin. So your water for skin get to work out for a certain way, and then you get to pee some for your kidney. It work out through your blood, and then you get to pee some for your kidney. The way nature make and say that water the work out through your blood. The one way the work out through your blood, no get to the join with the one way just dey inside your skin. So when that thing where liver get to produce some no day, that one way there for your skin with that one for your blood, they just the cross. So the one for your skin go just for your blood go just cross or go for your skin, and then now so that belly the fat. And then because the fat so the water all stay for your skin, your kidney, it the wait same water can make it go peace, the come. So your kidney too go fail. So you will get kidney failure. Sometimes you go end up for dialysis. And then your spleen where they for your left hand side, way to the work together with the liver, it to the beak, because it too not be feel pushed in there for go back for the liver. Anything way they try for pushed in for go for liver before liver send up for heart, it not the go, because liver don't turn stone. So you will see that picture for this man we get which they call say ascites, yellow eye jaundice. So important treatment for liver failure. Important treatment. Abstinence. It sounds very simple. Abstinence. Abstinence means stop for drink. When you don't start feel some small pain for you, not even wait until you feel pain, but if you don't start feel that pain, it will tell you say your liver don't start to complain. Stop for drink. When you stop for drink, your liver go grow back. It go fix itself back. And then you go be fine. If you no stop, you go progress to this third stage. First stage, you figure you back. You fix your skin. Second stage, possibility day. You don't be 50-50 now. But last stage, now in that, you not fit do anything again. For man we don't already get that liver disease, even small alcohol, it make things and the worse. So now it will increase your risk for alcohol liver disease. The amount of alcohol you drink. Go she down for off license. 1 bottle, 2 bottle, 3 bottle, 4 bottle. I show now how they say Cameroon bathes in alcohol. Natina what you do? Go she down for off license. Drink something you pass out. Drink something you vomit. Drink something you go piss for backside. Come back ask for more. Drink, and then money no day, and they still buy mimbo themselves. Now the best business that for your country. Now the best business that for that country. It be a bad situation. Say people they be so depressed, so unhappy, they be jobless in this country, and the only way they feel make themselves happy now for go sit down, drink alcohol. I don't know whether it be any wonder for see the Amazonian people them. They need a different situation. They need a different country where people they not go be so frustrated, so poor, so desperate, where they need not only alcohol for make them feel good. We need a country. And I hope that the thing that with these Amazonian people them, all of us, we the Amazonian, we the fight for. We need a country where it could get regulation on alcohol. Regulation on alcohol means if they catch you where you drink, where you don't drink, then you drive. Punishment get to be for that one. Because you don't put other people, their life in jeopardy. You don't put other people, their life. You take other people, their life away. Most time people they don't know say when you do things like that, you actually kill. You kill. Because when you go get that bus accident, all the people they die for dinner because you drink alcohol. You need to take responsibility. We need a country where it get law. You drink alcohol, you drive, you should be punished for that. We need a country where it get law for the age limit where people can get to drink. Age limit. People get to drink above 20 years old. Then that time if you work go for off license, say when I give me alcohol, then they give them for you. If not, below that age, it's a no. They get to the punish off license the way they give me but for college picking them, small picking them. It just be so much of our culture for drink alcohol. Even for here, for US, when we get occasion, alcohol no did in a bad occasion. But at least we all know for year to say if we drink too much, you know, if you drive. So even if alcohol they people they drink to their limit, drink in moderation. Funny story again about how they don't train all we for home. Right from the time when you dey small picking, mommy drink alcohol, drink a ton, a look picking, put them to for picking a mouth, picking to start drink. So the funny story I say, when I become here for US, when I be just come, I become with my son will be there 3 years old. We reach my brother-in-law with a New York. So we land for New York. My brother-in-law pick me up for New York. I will go for Florida, but we land for New York. So he pick me up, he go with them for a house. They make chop. They put her for table. After we don't go take shower, they put her for table, and then they put, of course, they know say we come up from Cameroon. We must drink we a beer. So of course, he don't bring Heineken. He put our table. I did look at now, what kind of small Heineken that? Anyway, because they're about to weigh in a 6 ounce, 12. So 12. So he put her for table there. I don't chop finish. As I chop finish, I open my Heineken. I did drink them. As I look my picking for corner. He too look me. He did look me. I turn. I take the beer. I start put out the picking mouth. He asked me. He say, "What are you doing?" I say, "Waity." He say, "You did put beer for picking mouth?" I say, "Yeah." He say, "If they catch you for the country, that thing where you just do and so, you go for prison and they will take that picking from you because they will consider say you be a bad parent." He said, "Never do that again. It is never allowed in this country." He go get to grow so that he reach the age of, I think it's 18. Reach the age of 18 before, if he walk into an off license, ask, say, "I want buy me," or for a place where they sell alcohol, ask them, say, "I want buy my own alcohol," then they sell them for you. Other than that, if any parent is caught, if they catch any parent where they give small pig in the mimbo, he's supposed to be jailed. Now, law than that, where they protect people. Every time they make this presentation, that they try for tell we, say, white man no get sense pass we. White man no better pass we. Now, because white man make law where they follow them. Now, because white man make law where they follow them, we don't make them look like say they better pass we. But they're not really better pass we. We need for the follow these laws them. If we need for create these laws them, follow the law them, so that we too feel live a better life. We feel get better life. We feel live till the age of 80, 90, 100. Now law. Follow the law. No bribery, no corruption. Follow the law. Wait till they increase your risk for liver disease again. The amount of alcohol where you drink, they increase your risk for liver disease. The length of time where you drink, you wake up for morning time, you go for off license, you drink, and you come back for night. You can't enter for house, you sleep. You never even give money for madam for cook chop. The length of time where you drink, now it also cause you to get liver disease. So then apart from that, we get some other reason them. Some people, the way they drink heavily, you get genetic factors. Some family, they just be liable for drink. Your papa be na drunkard. He don't pass that gene or that thing for you. So you to be more likely for drink because your papa be drink. Your grandpapa be drink, your grandmammy be drink. So when you look for family them, if one man be drink for that family, he born like 9 picking them or 7 picking them, 1 picking will come out for them or 2 picking them with them 2 they drink. Just the same. They call that genetic. he get them now from your papa or from your mommy. It no mean say you know if you prevent that. If you know say you come up for family way your papa be the drink or your mommy be the drink, make sure so you try everything for no drink. Do everything. Avoid alcohol. Avoid friend the way they drink. Avoid environment where alcohol dey plenty. Find some other thing where if he make you feel happy. Then avoid those things. Because you know say you come up for papa where be the drink means that when you touch one glass or one bottle for drink, you don't hook. Now from there you go start drink. They say black people them, they be more likely, especially Africans, they be more likely for drink than most other people them. I still feel say that one still get to do with the fact say we already first get papa, mommy, grandpapa them where they don't drink, so they pass on to us, so they drink. We grow up in that way. Women them, they be more likely to get a bad effect from alcohol than men, and I talk women they be more likely for develop that liver disease than men them. And then because we get other conditions for we are home, I go talk as I tell you, I go talk about hepatitis B. When I condition we did for home way, nobody know they talk about. They know they address them. So you get many people that they already get the hepatitis B around, and then they drink alcohol. Bad news. So you don't add two problems then for your liver, so you could get liver disease faster. And then it's obesity. For some reason, we too don't start get very fat, obese. I don't know where to be. I feel really likely put the reason to why we don't start be very obese too. But women they don't get very fat, men they don't get very fat. So as you the fat, you make that liver to be fatty. You put plenty fat for that liver. Then you add alcohol for the, then you add more fat for the liver. Then things that get worse. You see what I mean? No? Fat, alcohol, more fat, spoil the liver. So I will already talk about the complications them for liver disease, and I tell you, I say abstinence. Now one of the ways where you feel prevent the disease for grow very bad. So abstinence now one of the ways. And then chop. Man would already get this liver disease again. Go now get to the choose specific chop that you get to chop. You get to eat very good nutritious food, because your liver in itself not the work for produce those nice things them again. So you get to eat good food. Good food will get vitamins, so you make sure you take vitamin supplements them. Eat chop way get plenty protein for day, because that protein will only go now for your head, and then you go to confuse. Like I talk, good vitamin food, very nutritious food where you get to eat. And then for person we still get that liver, we get fat, or still there for that alcohol hepatitis stage where you feel reverse the situation. When you stop for drink and they like say go get better, they feel give you some medicine where they call us say steroids. They feel give you prednisolone or prednisone. They feel give you some other, so some two medicine, and the way they feel give you, when they give you feel get better again with the condition. Okay, so in most cases, like for this country, when you don't get that liver cirrhosis, when at the last stage for the liver, or you don't get the liver cancer, you don't get any other way again for recover. Remember I tell you, so that liver don't turn less stone. So now all that it's done. So you will get all that complication, the fat belly, then the cough blood, everything. The only treatment at this time, now say they go move, they feel move that liver, they give you another liver. They call them liver transplantation, organ transplantation or liver transplantation. Means say they fit take liver for some other man way, maybe be get accident, then you one die. He talk say, I fit give my liver for some man. Then they go take that liver, they fit give them for you. Then you feel live with that other liver. So they like how you call it, spare part. The only way you feel survive now, say you get to get another spare part. They will get to remove that bad liver, put another liver for you come up from some other person where you don't die. They put them for you before you feel survive. Unfortunately, for Africa, the only country right now where they do liver transplantation is South Africa. So which means if you get that condition for Cameroon, Amazonia, any other part of Africa, you could die because they not get means for give you any new liver. So if anybody tell you say, oh, I fix them, it is lie for you. The only way I say they will just give you small things that for manage for stay, no eat protein, take some vitamin, take some medicine so you not get nausea, vomiting, eat well so you stay healthy. Then you will live some few years or months and then you finally die. But for this country, you get liver transplantation, but it be very tricky. For man with the drink, most center them for year where they do transplant, because I don't work for that area where would they give would they do transplant for people them. The people the way that they get difficulty forget new liver now, especially person they drink alcohol, because they always believe say why you give them for man way the next thing we go do you go drink again, it destroy that liver. So wait till they always ask that kind of person, I say you get to show we proof say you know drink for 6 months, 6 whole months, you get to no touch alcohol at all. So that also depend on the fact say that your bad liver go fit keep you for 6 months. If that your bad liver keep you sitting for 6 months and you not touch any alcohol, then you come back again, they will review the case again, we will look at the case again, and then they will give you a new liver with the plan say you no go ever drink again. Then you can live another 10-20 years. I used to get some of my patients, they come where they don't live for 20 years with their liver where they be given for them. So let's say they be the 40 or 50 years time where we give them the liver. 20 years, you don't live 70 years. So now additional age that we don't gain them. Unlike somebody for Cameroon where at that age of 40 for don't die, since this person will live 20 more years. Can we get those things? Yes, we can. Why man not get sense pass way? So they usually put that liver for when the person will get accident or so, then the one die, then they move that liver for go give them for some other person. They carry inside some small box where they don't preserve, and then they come with them. Then they take and go for operating room. You take that man with own liver don't turn like stone. You go with them for operating room. They move that stone. Then they put that new liver. They connect the pipe them back. And then they bring the person back for ICU, and then we monitor the person, remove the breathing tube, they get better, they walk out of the hospital, they go live for another 20 years. Another topic we want to talk about, we usually be talked about a whole lot. Now alcohol, Tylenol, and liver disease. So most people that when they don't go binge drink or they don't go with friend them, then they drink the whole day or the whole night for party. They come, they go sleep, they get headache. They wake up, they go pick their bottle for Tylenol or Panadol or paracetamol. Take them, drink them. Bad, 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 bad. You don't make things and worse. So, as I be dey explain for una, na liver is the clean house for all medicine the way you dey drink. When you drink the medicine, it go for liver. Liver take wetin be good, it give am for the whole skin, and then the bad part is send am out. So na clean house. You go say, why other medicine they not do the same thing? No, Tylenol specifically. When Tylenol go for liver, only Tylenol E1, it go for liver. Liver get to change. That means the work way liver get to do with Tylenol, it big. So liver go get to change that Tylenol into something where it be a little bit toxic. So it change that thing into something a little bit toxic. That it throw them out. Then the good part of the Tylenol, the body go use them. So usually that process for happen, it take about a lot of function for that liver for do that. So liver just for break down Tylenol, it take a lot for liver for do that work. So alcohol in itself, it already give too much work for liver. So it task the liver, it make liver work over. Then you take Tylenol to where it would give too much work for liver for work. So the two then go, they meet up for that liver. Alcohol it make liver the struggle. Tylenol don't come, it can't add the work for the liver. The liver they fail fast. So your liver go fail faster than if you be only the alcohol. So alcohol first don't spoil them, then you can add Tylenol. So Tylenol is a no. I know that you fit talk say there's a quantity where you fit take them where be safe. I would rather not talk of a quantity where you fit take them where be safe, because sometimes it be difficult for know how much you don't drink, how much Tylenol if you take. I would rather talk about the fact say don't take Tylenol, paracetamol, Panadol when you don't drink alcohol, especially if you don't drink plenty, because it over task your liver. The same place where Tylenol they work for liver, and the same place where alcohol they work, it overwhelm the liver go fail. Okay, so I get recommendation for taking Tylenol for my PowerPoint, but like I talk, I would rather not talk about say you take Tylenol. I would rather, if you don't drink plenty, take Motrin, take an NSAID, take Advil, take anything thing like that, but avoid Tylenol, avoid paracetamol, avoid Panadol, avoid anything that has acetaminophen. They say you don't take more than, so daily, even Tylenol is something we always take on daily, especially for the white man country, more than people than for home. Not take more than 3,000 milligrams of Tylenol a day. So Tylenol, for some country, then are 650 milligrams. So you take 2 tablets for morning, 2 tablets for evening. That should be enough. It never reach 3,000, but that should be enough. For some country, then are 500 milligrams. So if you take them for morning, afternoon, evening. So no take Tylenol for more than 10 days or 3 days in succession. So 10 days for fever, 3 days for 10 days for pain, 3 days for fever. In actual fact, don't make a habit for the take Tylenol. Well, for hospital, when somebody don't get like operation, then we put it for Tylenol. We must always put a stop date when we want that Tylenol for stop, because we don't want to say, may they just continue for the giddy man Tylenol, then all man forget. The next thing eye don't yellow, then with the shock. So we put a stop date. Most often we not pass like 3 days or 4 days. We put a stop date for the time we for the Tylenol where they get to give it. Then when it reach the 3 days or the 4 days, then we re-evaluate. We see whether you need them again or you're not or not. So they say after drinking 1 alcohol drink per day, 1 alcohol drink now for our Cameroon bottle, because we are bottle big. For an American bottle, if you drink 2 this small bottle, you still take your Tylenol. For Cameroon bottle, 1 that big bottle, you still take Tylenol. But after that big bottle, you don't already cross the threshold, no take Tylenol. If you take Tylenol, Panadol also, the 2 of them go combine, they will make your liver worse. I want to end this conversation because I hope all man understand and wait till they try for talk. We do overdrink for Cameroon, and I think so. We overdrink out of frustration too. First jobs in a day. So all we do now for wake up for morning time, go down for off license, talk from morning to evening. If people they get workplace so they go there, how do money wake up for morning time, go for off license? You wake up go now for your work, you better not drink alcohol before you show up for your work because they get to fire you. So you drink alcohol. So but since people they be jobless, what else do? They go shit down only for. I really hope say the new country, our Ambazonia. It's not really a new country, we don't already they exist. But our Ambazonia country, we go get them. We go get these laws. For proof say white man no get sense pass we. For proof say we just need for manage we are money fine. We just need for manage we are law them fine. We just need for treat we ourselves them like human being. Will not be beef. Will not be goat, will not be cow. Treat yourself with respect. When we surround yourself with all the dirty, them will throw for road, for backside house, for front house. The pictures then they go around the world. This one I talk to for our parents them. And then we send we are picking them for white man country. And then white man they treat we the same way like the picture the way they see them from Africa. Treat we like dirty. Treat we like nobody. Would they show surprise? We call it discrimination. White man never show respect for we because we never show respect to for yourself. We not show respect for yourself. We get all the resources white man come for your land. Can't take them for we like say they take small bonbon for small picking hand. They can't carry them every day, can't fix their own land. And we get people them for home. We call and say leaders them. They only know for build big house them for their village. Fly for London for go get treatment. You know fix your own homeland. Whether you can fly for London, whether you can build a big house, you have no respect. Because they equate you to how dirty your country is. They equate you to the poverty waiting for your land. Until we wake up, we realize, say, respect is earned. Respect, that's something we'll get to earn them. We get to show people them, and then they show we respect. And we're starting now from our homeland. Clean them. Get good road them. Clean hospital, good education, law, then way people that you follow them. We go get respect to around the world. Other African countries, they don't live with far behind, far behind. I get picture for here for Rich Hospital for Ghana. Look at that hospital for Ghana. Look the bed them for inside the hospital. Now the same bed them waiting they here for USA. Who self say now only white man fit sleep for the kind bed? Why we no fit sleep for the kind bed for Africa or for Cameroon or for Ambazonia? Why we no fit sleep for the kind bed? Why we no fit get transplant? Why no fit get liver transplant for my country? We deserve all these things them. And until we figure out say we deserve all these things them, among no they leave white man they come for they can't take thing them for we like say they take a small bonbon for small picking in hand. Until we ask the people the way they say we are leader them, make them do their job, not before build mansion them for their country. We go so they die young. We go so they bathe inside alcohol, destroy our liver, die, pass that same gene, that same characteristic, that same behavior for your next speaking them. Your next speaking them pass on for your next speaking them. Alcohol. French company they go come, they so can't take their money, then go. One picking go come or come for white man country. All man dance, one picking don't come for white man country. The rest then they die. I did do this education also because I really want some more people then understand. Say the thing the way that the key way we think say na impossible things them. Not be really impossible things them. Every day you go for hospital, they say you get malaria or you get typhoid. Other diseases and there for this world. Plenty. And we did die from those diseases and from home. And not just because they not even first do the diagnosis. Where they tell us say when I drink that alcohol, your liver they fail. And you did die. Plenty people they die from that. When you listen to this video, take them serious. Because I speak from the heart. I take time for prepare this thing. I take time for prepare this topic. I take time for she don't for talk. Because I want make we listen. Make we listen good. Thanks. I thank all man we listen to this video. And I end the video for show now hospital for Bamenda. Regional hospital for Bamenda. Whether they be bill now which year. It never changed from the time they be bill. The same bed them way they be daily, whether not for 1960 or even 1910, they still did the same bed. Look at the outside, you're not even in a hospital. That we can do better. Bye.